Welcome to today's Explainer. We're jumping right into a topic that is, well, profoundly important, maybe a little sensitive for some, but absolutely crucial to understand: male vitality and aging. We're going to look at the science of mastering male aging, and we're doing it completely free of stigma. So let's just dive right in and peel back the layers on how men can actually maintain their strength, stamina, and confidence over the years.
To kick things off, we really need to ask a pivotal question. Is vitality loss strictly an old man's problem? You know, there's this pervasive, almost accepted myth in our culture that declining energy and physical drive only happen when you hit your senior years. But as we dig into the source material today, we're going to completely challenge that assumption.
Just look at this stark, fascinating contrast from our sources. On one hand, you've got a man nearing 60 who feels incredibly strong and full of life, and right next to that, a 37-year-old guy who's already facing a severe decline in his vitality. It's crazy, right? But it proves that what we're talking about today is a universal issue. It's not just some number on your birth certificate, it's a physiological reality that can hit you at literally any stage of life.
So here's our roadmap for this explainer. 1. Men's issues. 2. Modern medicine perspective. 3. Traditional medicine lens. 4. Physical training solutions. And 5. Unblocking and psychology. All right, Section 1. Men's issues beyond the surface. We really need to establish right out of the gate that what we're discussing goes way, way beyond just physical stamina. The absolutely crucial point here is that this decline touches everything. It's a broad issue affecting both physical health and your deep, private mental well-being. And you know what? Naming and acknowledging this holistic problem is the very first step to stripping away the stigma. Because when men feel that drop in vitality, it almost always leads to this silent anxiety, messing with their mood, their confidence, and just their overall quality of life. We've got to look at the whole picture.
Moving on to Section 2, Modern Medicine Perspective, Naming It to Tame It.
So in Western medicine, this condition actually has a specific clinical name: male menopause. Now, unlike female menopause, which is often this sudden biological stop, male menopause is a gradual, kind of hidden decline of the male hormone testosterone. But notice the key term here: measurable. That's huge, because this isn't all in your head. It is measurable via simple blood tests. When testosterone drops below normal levels, that's when you start seeing the symptoms: the increased belly fat, constant fatigue, muscle loss, mood swings. It's a completely biological process.
To give you a really practical benchmark from the medical community, let's look at Professor Tran Quan An's Rule of 9. I want you to do some quick mental math with me here. Take the first digit of your age, let's just use a 50-year-old as an example, and multiply it by 9.
So 5 times 9 gives us 45. Now, what exactly does that mean? Well, in this clinical rule of thumb, you actually split that number. The first digit, the 4, represents the number of weeks. The second digit, the 5, represents the frequency. So, for a healthy 50-year-old, a baseline of 5 times in 4 weeks is considered a reasonable, healthy frequency for intimacy. Obviously, it's not some absolute unbreakable law, but it provides a super helpful, easy-to-remember clinical baseline to gauge exactly where your vitality stands.
Next up, Section 3, Traditional Medicine Lens, Reframing the Issue. Now, traditional medicine doesn't look at this as an isolated, localized hormone issue. They call it yang impotence, or essentially a fundamental deficiency. Their focus isn't just on boosting a single chemical in the body. Nope, it's on an imbalance of the entire body. They're looking at the flow of qi, your vital energy, and blood. They examine the fundamental strength or weakness of your internal organs, like the kidneys, heart, and spleen. It is a completely systemic view.
And the data totally backs this up. Check out this study of 375 patients. It perfectly supports this ancient wisdom. A massive 65% of these cases stemmed from what they call a fundamental energy deficiency. This literally means the core foundation, the root energy of the body, was depleted. The other 35% involved heart and spleen deficiencies, which are actually heavily linked to anxiety and digestive stress. The traditional medicine lens is basically telling us that once this root energy is weakened, the external symptoms become severe. We've got to treat the foundation, not just put a Band-Aid on the surface.
All right, let's get into solutions. Section 4, Physical Training Solutions, Rebuilding the Core.
The sources highlight 4 essential, highly practical exercises to unblock the physical plumbing and rebuild your strength. First up, the plank. It stabilizes your posture and builds incredible core endurance. Second, crunches. These directly combat the fatigue of male menopause by building total body stamina. Third, and definitely pay attention to this one, lunges.
Lunges act like a massive blood pump, forcefully driving circulation down into the entire lower body, which is absolutely critical for vitality. And finally, the Kegel. Now this is often overlooked by guys, but it directly targets and strengthens the pelvic floor muscles, giving you immediate improvements in physical control and function. Look, these aren't just for looking good at the gym. This is functional medicine in action.
Bringing it all together now. Section 5. Unblocking and Psychology. Mind and Body Integration.
Here's the thing. You can do all the physical training in the world, but if your internal pathways are blocked, you just aren't going to see results. The source material uses this incredibly powerful metaphor to explain it. Think of your vitality as a fire. Often the fire, that psychological desire, is still burning brightly. The problem isn't the fire, it's the fuel pipe. Your blood circulation is literally the pipe delivering fuel to the fire. If that pipe is clogged or restricted, the fire simply cannot burn, no matter how much you want it to.
Let's build on that imagery for a second. Think of your circulatory system as this vast network of irrigation canals meant to water a field. What happens when mud builds up in those canals? The water stops flowing and the field dries up, right? Well, in our bodies, that mud is blood fat, cholesterol, and systemic inflammation. If we don't clear the mud, the vital energy in blood cannot flow to where it's needed most. We have to unblock those canals.
To help clear these blockages externally, traditional practices suggest natural unblocking therapies. One really specific method mentioned in our sources involves combining warm castor oil with pine essential oil for a gentle massage. The logic behind this is actually quite fascinating. The castor oil acts as a deep penetrating carrier, while the pine oil is used for its natural ability to soften hardened tissues and reduce local inflammation. It's a very ancient, practical, external way to support that internal flow.
But as we start to wrap up this explainer, we really have to address the mind. The single most profound takeaway from the sources is this exact quote. A man's value isn't defined by a biological function. It lies in bravery, love, and self-respect. Vitality is important, for sure, but true worth goes far, far beyond physical metrics. Honestly, letting go of the anxiety surrounding age and biology is often the biggest mental unblocking you can possibly do.
So what does this all mean? The goal isn't to magically reverse time and become 20 again. There's no way. The goal is to master your age wisely, combining the precision of modern medicine with the holistic, grounded wisdom of traditional practices. We've laid out the roadmap for you, from the rule of 9 to those blood-pumping lunges to clearing the mud from your canals. The only question left to ask is, what will your starting point be? Thanks so much for joining me on this explainer, and I will see you next time.